Perfect. So hello, welcome everyone, and good evening to this webinar on dental team fatigue in the context of COVID-19 and special care dentistry. It's hosted, as you know, by the Irish Society for Disability and Oral Health. And for those of you who've attended in the past one of our webinars, you'll know that Kev used to give a very eloquent introduction in Irish, but I'm not going to embarrass myself or insult the language by doing the same, but I'll just say Falcha, and it's Misha Ahmed Khatab. Joined with me is Dr. Koula Asimakopoulou, a registered health psychologist, as you know, sharing her knowledge on the topic of recognizing and managing fatigue in ourselves and in others. I want to preface this by saying that this isn't a form of therapy. You're not going to leave here on cloud 9 and without a care in the world. But what you will gain, hopefully, is some insight on as to how to recognize if you or someone around you is feeling overwhelmed, and hopefully simple tricks to deal with the psychological effects of mutual stressors like that you find in special care dentistry. I've attended one of Koula's presentations before in the past, and I was, you're definitely in for a treat anyway. So just before I introduce Koula, just to go over a couple of housekeeping. The Q&A you'll see at the bottom of your pane. So please feel free to ask any questions throughout the presentation. And then we will choose a handful at the end to pose to Koula. And also, other attendees are free to share their perspectives on the question that's asked. So I'd highly encourage you to engage with the chat function as well that you see at the bottom. And just to share your experiences and thoughts on what's being discussed here, and your own stressors, as well as little tips that you've managed to find along the way, so that you can help and respond to one another through the chat function like that. There will be polls throughout as well to encourage interaction, and also to give Koula an idea of the kind of background and thoughts from all of you who she's speaking with. So on that note, actually, I might just start the first poll here, and I'll launch it here just to give people an idea of where we're all coming from, what our professional background is. So I'll leave this open for a couple of seconds for everyone to start voting in, and then I will share the results. That's great, they're all coming in, that's perfect. Just a couple more seconds now. Perfect. Interesting. So these are the results here. Quite interesting. I mean, you can tell, general dentist, it's of no surprise there, but the other, I'm interested to see who the other is. I probably should have put more options down there. And panelists can't vote, of course, so that's why there's nothing in psychologist. But that's fascinating. So now we have a kind of broad idea of our audience, which is great. So I'll just come out of that now. And then there's the last thing is as well, just before we're finished the presentation, please feel free to raise your hand at the end if you want to share your thoughts vocally on a particular point that's really encouraged, and it stimulates conversation and debate. So we're back to the star of the show. So Koula is a chartered psychologist based in the UK. Clinically, she delivers support to healthcare professionals as well as their patients, and she's also a very well-established academic, publishing research in behavioural change in the oral healthcare setting, and supporting dental teams and providing care to patients. She's presented on many national and international platforms, and among all of this, she still manages to make time for her family. So hopefully we'll learn one or two of her secrets. Fair play, yeah. So hopefully we'll leave the rest to her and learn hopefully from her broad skill set. So take it away, Koula.
Oh, well, thank you. This is all amazing. This great introduction. Thank you very much for inviting me to come along. Hopefully, you will not see an unruly child just coming in through that door in a minute, and then you realise just how the psychologist cannot actually control her own children. But hey, we'll cross that bridge if we come to it. So yeah, thank you very much. This is the moment where I have stress and panic building up, thinking, oh my God, I've prepared so much to show you, and there will be not enough time. So I will whiz through this presentation, and hopefully there'll be lots of time for questions in the end. So I am going to share my screen, and hopefully...
That's perfect, thank you.
Yeah, brilliant. Okay, and sadly it's disappeared off my other screen. Hold on. Why is it doing that? Didn't do that earlier. Do you see lots of slides on my screen? Or...
Yeah, I can't see the presentation format.
Hold on. Yeah, so I'm going to play from start. There we are. Hey, success. Right. So this is what I'm going to talk to you about. I'm going to talk to you a little bit about stress and fatigue and burnout. And then we're going to spend hopefully most of our time on tips to deal with this distressing situation. So by the end of our chat tonight, you'll be hopefully have a better understanding what stress, fatigue and burnout are, just in case you didn't know, just in case you had really nice sheltered upbringings and you didn't know what stress was. Here's a psychologist who's going to tell you what it is. But we're going to look at the differences between stress, fatigue and burnout. We're going to look at the signs of each, and then, as I said, we're going to mainly focus on some of the behavioural tools that are available to us to try and deal with the psychological impacts of each one of those. So no talk worth its salt would have no definitions. So I thought I'll get the definitions out of the way early, and then we can focus on what to do about it all. So as you know, stress is what your body does when it perceives that demands are being placed upon it. And the demands don't necessarily have to be negative or terrible or bad. If you think of a happy situation in your life, say going off to a party, getting married, having children, meeting friends at the pub, or in the days when we used to be able to do that, even the happiest moments in life are normally associated with a degree of stress, either before the happy event or afterwards. So stress is there, it's part of life, it's unavoidable, and I'll be arguing that it's normal. It's a normal reaction. Fatigue, on the other hand, is this extreme form of tiredness. Often people talk about this in terms of exhaustion. And you can have acute fatigue that kind of comes and strikes you and then goes, or you can have chronic fatigue that you just cannot shift. And then burnout is your red light. So burnout is this chronic form of fatigue that really messes people around, really interferes with their day-to-day function. So I think it's important to differentiate between stress and burnout, because burnout is not just workplace stress. So burnout is the big horrible beast. It's stress that has been going on for some time and which has not been effectively managed. And you know that it's burnout as opposed to stress that you're suffering from, because with burnout there are three key features. So the first one is exhaustion, and that could be psychological exhaustion, physical exhaustion, or a combination of both. And the second feature that really starts moving it from stress to burnout is mental distance. So this is where you actively take yourself away from work because you simply haven't got the headspace to think about it anymore, to worry about it, to engage with it. So it's an active distancing from the workplace and the work situation and the people you work with and the patients you help, followed by normally negativism and cynicism. So it's this bitter, cynical, negative view that a lot of people who suffered burnout will show, where it goes well and over, well and above stress. So stress in itself is a feature of burnout, but it needs to be followed normally by feelings of cynicism about the job and the people you work with and negativism. And probably because of a combination of those two, but not necessarily, the third feature of burnout is reduced professional efficacy. And that can be real, as in you really cannot do the job anymore, or perceived. So it could be that you're doing the job fairly well, but you're telling yourself that you're not very good at it. So hopefully you can start seeing what burnout actually looks like. It's not just stress or stress that has gone on for a long time. It has features that are more than stress, and the cynicism, the mental distancing, and the perceptions that you just cannot do this anymore are the key features. And people who've worked in the area tended to see stress and burnout as really quite opposite. So with stress, there is this over-engagement. There is a belief that if only you had a few more hours, if only you had a few more resources, if only you were a bit more able to deal with this, you'd be doing a good job, and you've got an interest in doing a better job. With burnout, it's very much a sitting back and thinking, well, there is no way I can do this. So people working in the field tend to see stress as a high activity emotional state, where emotions are overreactive. There's this sense of urgency and moving quickly and trying to do lots. And burnout on the opposite end is this helplessness and hopelessness and feeling that there is no point to any of this. So stress tends to be linked with anxiety. Burnout tends to be, but is not necessarily just linked with depression. So hopefully you can see that the two are really qualitatively quite different. So put simply, if going to work was like going to climb a mountain, when we all first started in our professions, we might have had a view such as this. So look at the view. Isn't climbing a mountain wonderful? I love climbing mountains. I can't wait to get climbing. I think that was me 25 years ago. And then stress comes in, and then you're a little bit more aware of the dangers of climbing and the exhaustion that can follow from climbing. And you like climbing, but you want climbing to be right for you to properly enjoy it. So you want to have the right tools to go climbing. You want the weather to be a little bit nicer. So this is where the honeymoon period of working with others in high stress environments kind of stops, and reality kicks in, and stress might start becoming an issue. And then burnout is this cynical, distance, really fed up negative attitude, where it comes out as bitterness and being properly negative and fed up about it. So these are just some quotes that hopefully will help you to appreciate the differences between being stressed and being burnt out. So because burnout is quite awful, and the literature on it, on how you can help people who are at the burnout stage, makes for very grim reading, in that there is no obvious go-to place to help people reliably and effectively in the long term with burnout. There are things we can do to help, but there is no conclusive tool we can use to really help people come back from burnout. It's best that, one, we know that it is burnout we're looking at, and two, that we don't actually get to that stage. So it's really important that we catch this before it becomes a full-blown burnout. So it's very, very important that we're able to measure it accurately. And the gold standard for measuring burnout is a self-report questionnaire by Maslach that was put together back in 1996, still the gold standard. And what this does is it asks you to self-report about how you've been feeling about work on a scale from everyday to never, on a range of questions that tap each one of those three features of burnout that I talked to you about. And what it does is it works out a score for each one of the defining features of burnout, and then a total score overall. And then it classifies it in terms of low level, moderate, or high level burnout. So these are some of the typical questions that you would be asked to measure exhaustion. These would assess the distancing and depersonalization. And then these would be items that look at how you feel about your effectiveness at work and your personal achievement. Now, I expect people in the audience may well want to access the burnout questionnaire and actually see where they score on this. It's beyond the purpose of this session, as we said at the beginning, to actually offer therapy or assess you in any way. But if you did want to have a look at the Maslach burnout inventory, if you go onto if you type in that link onto your browser, you should be able to come up with a PDF which has a full scale on, and you can go through it, assess the different areas, and use it as an indicator rather than a diagnostic tool of where you actually are on this scale. Okay, so that's stress, fatigue, and burnout in a whiz. What I thought I might do next is see where you think you are in terms of the concepts I've just described. And what I'm going to do is do a poll. So what I'd like you to do is look at this scale and think about the past week. And don't choose a number from 0 to 100 because there is no number, because we can't do numbers on this scale. But these are your categories. So it's settled, stressed, fatigued, and burned out. So what we'd like to know is, how have you been feeling over the past week? If you could vote now, that would be really great. Okay, have we got a poll? So we have 33% settled, 27% fatigue, third category is burned out, and quite a few of you were stressed. So fairly equal mix between stressed, fatigued, and burned out. Okay, so I'm next going to move on to, whoops, come on, move, there we are. How are you feeling right now? So again, don't use a scale from 0 to 100 because we haven't got those numbers. But imagine that the scale runs from 0 to 100 and pick a settled, stress, fatigue to burnt out category to describe how you're feeling this very moment. Okay. Have we got any results? Okay. Right. So look at those figures. So a large percentage of you are, luckily, thank God for this, you're settled. Now, I could take this personally and think that it's my great talk that's settling you, but actually it is you who's doing this to you. You are feeling settled because you are able to be in a good place at this very moment. You're able to switch off from work and engage with this presentation at this very moment. And the point of this exercise is to show you that stress, fatigue, and to a certain extent burnout are not concepts that should define you. So you could be feeling burned out at one part of your life, but it's quite possible to have snippets of space and time where you do feel settled. So the literature would then suggest that if you're burned out, that's it, you're burned out, and you tend to see the world in a burned out way. My personal view on this is that actually burnout is probably something linked to a very specific environment and how you interact with work. And given the right supporting techniques and headspace, you can actually step out of your burnout and be able to be settled. And that's why I think it's generally good news that we are able to do that. So stress and fatigue, and to a certain extent burnout, are transient. Okay, you're not stuck in those. There are things you can do. Just as well, because if there weren't, the psychologists would be out of work. There would be nothing for us to do. We'd have to say, well, that's it. We can't help you. Go away. You're burned out. So who is doing this to us? Who is stressing us? Well, I went to a talk the other day on microaggressions, and I was told that it's all the media's fault. Media and the social media, they are the main responsible factors for our stress. And I think they probably have a role to play. Other people, unreasonable bosses, they have something to do with our stress levels and our fatigue. Lack of tools and resources, probably going to be very responsible. Lack of time. And then cake mix. And what this means is actually it's a combination of all of those things, and things like our predispositions, our preferred ways of interacting with the world, our personality, our positive or negative outlook to life, and so on. So it's probably a combination of all these factors that are responsible for people's stress, fatigue, and burnout. So there's a key ingredient here that's missing. And that's us. That's our heads. Now, I'm not for a minute suggesting that our heads are solely responsible for our stress and fatigue and burnout, but we can control our heads and what we tell ourselves about the situation, and what we tell ourselves about the situation can influence the view we take of it. So I'm going to ask you an obvious question. How many of us are in the audience today? I can't see how many we are, so someone might be able to tell me.
Yeah, so I can tell you here, Koula, we have 40 people with us today.
40 people, right. Well, I'm going to demonstrate to you that actually there's more than 40 people in the audience today. So what I'd like you to do is follow through with this very brief exercise. Okay, so wherever you're sitting, just make yourself comfortable and just follow the instructions. Don't overthink it, just follow through and see what happens. Okay, are you ready? Here we go. So I'd like you to sit up straight, let your shoulders drop, and gently push your feet into the floor and get a sense of the ground beneath you. And you can either fix your eyes on a spot or close them, whichever you prefer. So now take a moment to notice how you're sitting. And now notice how you're breathing. Notice what you can see. Notice what you can hear. And then notice what you can feel against your skin. And then notice what you're thinking. And then notice what you're doing. So there's a part of you in there that can notice everything that you see and hear and touch and taste and smell and think and feel. We don't have a good word for it, but we're going to call it the observing self for now. And life is like a stage show, and on that stage are all your thoughts and all your feelings and everything that you can see and hear and touch and taste and smell. And the observing self is that part of you that can step back and watch the stage show, focusing in on any part of it. So next, what I'd like you to do is focus on emptying out your lungs. Push all the air out of them until there's no more left, and then allow them to gently fill all by themselves. Really notice the breath. Just notice it flowing in and out. Observe it as if you're a curious scientist who has never encountered breathing before. Just notice how once the lungs are empty, they automatically refill all by themselves. And I invite you now to undertake a challenge. For the next couple of breaths, just keep your attention on your breath, observing it as it flows in and out. And we're going to do this for the next 10 seconds. You will find this task really hard because your mind is a masterful storyteller. It will tell you all sorts of interesting stories to grab your attention and pull you away from what you're doing. See if you can just let those thoughts come and go as if they're just passing cars, and keep your attention on the breath. So notice your abdomen rising and falling. Notice your breath flowing in and out. Notice the rise and fall of your chest. Let your mind chatter away as if it's just a radio playing in the background. Don't try to turn it off, just let it play on in the background and keep your attention on the breath. From time to time, your mind will succeed in distracting you. It will hook you in with a really good story, and you lose track of your breathing. That's normal and natural, and it will happen repeatedly. The moment you realize this has happened, just take a moment to note what hooked you, and then gently refocus on your breathing. Again and again and again, you will drift off into your thoughts. Now, this is normal and natural and happens to everyone. So as soon as you realize it, gently acknowledge it and come back on your breath. Okay, so the point of this exercise was not to get you to relax or indeed to focus on your breath. The focus of this exercise is to notice that there isn't just 40 of us in the audience today. There is those 40 of you who are sitting there listening to me. And then there are 40 minds in the background, interpreting what I'm saying, giving you the, oh my God, what's she saying now? What's she going to say next? Oh, I wish the kids would be quiet. What do I have to do tomorrow? Oh my God, it's been a really rubbish day. So there's you listening to me today at this very moment. And then there's your mind giving you the, look out, you've got other things to think about. You can't really just be paying attention to this. So there is in fact 80 of us in this audience today. There is you and there's your mind. And it's that aspect, it's that mind that constantly looks out for danger and warns you about possible things that are going to come and get you. And it's that is responsible for your stress, your fatigue, and your burnout. I'm going to share a very brief video that talks a little bit more about this idea of the thinking mind.
The human mind has evolved to think in such a way that it naturally creates psychological suffering. You see, back in the Stone Age, 200,000 years ago, life was pretty dangerous for our caveman ancestors. So if a caveman or cavewoman wanted to survive, their minds had to constantly be on the lookout for things that might hurt or harm them. And if that cave person's mind wasn't good at predicting, spotting, or avoiding danger, what happened to her? The default setting of the caveman mind was safety first. And we in the modern world have inherited this. Our modern minds are constantly warning us of things that might hurt or harm us. The caveman mind says, watch out, there might be a bear in that cave, you could get eaten. Watch out, that shadow on the horizon might be an enemy from another clan, you could get speared. Our modern mind then does worrying, predicting the worst, avoiding anything that scares you, anxiety in all of its different forms. Back in caveman days, you survive an encounter with a bear or a wolf, then it's useful to replay it. It's useful for your mind to go over the events and remember what you did to survive so that you're better prepared for next time. But in our modern world, we go over and over painful memories, dwelling on them, reliving them, even when there's nothing useful to learn or the lesson has been well and truly learned a long time ago. In the Stone Age era, as a caveman or cavewoman, you have to fit in with the group. If you are alone, you will soon die. So your mind compares you to others in the group. Am I fitting in? Am I contributing enough? Am I following the rules? Am I doing anything that might get me thrown out? Now, in modern life, we're always comparing ourselves to others. But the problem is we're no longer in a small group. Our groups are enormous today, and we carry with us devices that constantly feed us images and stories of people all over the planet. This constant comparison ramps up our fear of being judged or rejected or not fitting in or just not being good enough. The caveman mind tells you you need more food, you need more water, better weapons, better shelter. The cave people who thought this way lived longer and had more offspring. Unfortunately, in the modern world, this manifests as greed, dissatisfaction, craving, wanting. It's never enough. I need more, more, more. And if all of that wasn't bad enough, these Stone Age thought patterns are intensified by the sheer pace and complexity of modern life. Our frantic existence, rushing from task to task, that never-ending to-do list. So, when your mind starts doing this unhelpful stuff, as all minds do, remember it's not defective or abnormal, and it's not deliberately trying to make your life difficult. It's simply doing the job it has evolved to do, trying to keep you safe and save you from pain.
So there we are. I hope this has given you a bit of an idea of how we currently look at stress. So we look at stress as something that an overzealous mind.
The human mind has evolved.
Watch this. That an overzealous thinking mind is doing to us in an attempt to protect us. And that is not because your mind is dysfunctional or dodgy or broken in some way. It's because we have inherited the predisposition to constantly be looking out for danger, which then makes us pay more attention to potentially stressful events, and then get stressed, fatigued, and so what can we do? What can we do to keep this overzealous thinking mind that we're just trying to protect us from bears and other huge animals from our ancestors? What are we going to do to keep that mind in check? So there are some practical tips that you can consider doing, and the whole point of this is to look at the raindrops and try and catch them before they become a storm. Okay, so it's the early intervention is what I'm hoping that you'll take away from this is really, really important. So ultimately, it's not all in our heads, it's not all in our minds. The environment that we find ourselves working in has a lot to answer for our stress and fatigue. So if there are changes you can make to the environment, then obviously that has to be your number one go-to place. Seeking support from others, opening up, discussing how you're feeling is very, very important. Connecting with something that you see as valuable, finding value in what you do, finding something that actually speaks to you is really, really important, can also help. Establishing work-home boundaries, says the person who's given a talk at 8 o'clock in the evening, having started her day at 7:30. That's a good tip. Pencil in your diary self-care. That's very, very important. And then look at your thinking. So this is where psychologists, we think are at our best in offering some sort of practical advice. So let's look at the thinking. Look at those two pictures. Tell me what you can see. Have we got the polls ready? Tell me what you can see in the first picture. You might have to move the poll if it's obstructing your view. And tell me what you can see in the second image. Okay, we've got an answer. What can we see in the first image? Okay, a lot of you can see a duck. Some of you can see a rabbit, and both can see both. Okay, how about the second image? Majority can see a young woman looking away from us. Some people can see an old woman, and some people can see both a young and old woman. The reason why I'm showing you this ambiguous images is because, as you know, what is actually going on here is just a random black line. That's what is being picked up by your retina into your optic nerve, into your visual cortex. It's your brain that actually puts together the pattern of black and white lines and tells you what it is that you can see. And the brilliant thing about this is that once you can see one image and someone says, oh, you know, you can see a duck, actually, look, there's also a rabbit there, and you can see the rabbit, then you can see both, and you will never, ever, only ever be able to see one or another. You'll be able to see both. So this is evidence that your brilliant brain that seeks to protect you has a preferred way of interacting with the world. But once you show it a different way, it will quite happily oblige. It will quite happily look at the different way of looking at the world. And that's where CBT comes from. So CBT helps you look at the world from different perspectives. So CBT is about looking at whether the threat your mind is telling you to focus on is actually real. Is it really a bear chasing you in the jungle? And the techniques, there are lots and lots of techniques that we use to help people tweak their thinking a little bit so they can respond to the stressful event differently. We look at their habits, we look at their thinking habits and see whether there are any unhelpful ones. One of the exercises we might use is to look at the worst thing, the best thing, and the likely thing that's going to happen. So if I'm telling myself other people are going to really judge me if I don't respond to all 136 emails in the same day, we work through this thought through, well, if you don't respond to all 136 emails in a day, what's the worst thing can actually happen? And people will tell you, well, actually, I don't know, my line manager might think I'm not very competent, but that's about the worst thing that can happen. What's the best thing that can happen? Oh, the best thing that can happen is that other people who are also unable to answer all 136 emails and they might think, oh, that's normal to not be able to answer them. I might help someone. And what's the likely thing that will happen? The likely thing that will happen is no one's going to die. Emails will still be there in your inbox to be answered the following day. So being scaling the stressor and actually working it out to what is the worst possible outcome, what's the best thing that can happen, what's the likely thing that will happen, it gives you a bit of a flavor of the techniques that we use in CBT to help people who say have a preference for the duck to then look at the rabbit, or have the preference for looking at an old woman to look at the young woman. That's what CBT does. It looks at your stressor and it says, well, is this the most helpful way to think about this? Let's look at whether there is another, a different, a better way to look at the same situation. It also works on this assumption that when we feel stressed or fatigued or a bit burnt out, that tends to come about because we hold on to real rigid rules that we tell ourselves are universal truths. So we tend to see the world in fairly fixed ways. So good employees answer all 136 emails very quickly, very efficiently every day. You're never late to the deadline. You are nice to every single patient you meet. You have ample amounts of patience with all your students, all your colleagues. You never get upset, and you're always on time. These are rules that I might be telling myself about my work situation, but they're opinions. They're not facts. They're not written down anywhere. It would be nice if they were true, and it would be nice if I could live up to these rules all the time, but they're not universally accepted rules. So CBT helps you tease apart the things that you tell yourself about the world. Are they real facts, or are they actually opinions? And it helps you move from a situation where you see the world as having shoulds, musts, and ought tos, to a situation where you can step back and say, well, actually, it would be preferable if X, Y, and Z, if I could answer 136 emails, but the world won't stop going around if I don't. That's what CBT does. And in some studies, it's been shown to have been quite a good, effective way of dealing with burnout, definitely a good way of dealing with stress. Sometimes, though, the things that trouble you are universally applicable rules. They're not opinions, they're facts. They're things that most people would agree are actually stressful. So then the question is, what do you do with that? Well, you can't challenge your thinking because your thinking is actually right. There's nothing unhelpful about it. It's all true. What do you do with that? And for that, we have acceptance and commitment therapy. And acceptance and commitment therapy is not about accepting that things are difficult. It's about being able to distance yourself from that thinking mind that really is trying its best to protect you. So I'm going to show you another quick video that talks a little bit about this approach and see what you think.
The human mind is a lot like radio doom and gloom. It broadcasts a lot of negative stuff about the past. Old painful memories, hurts, memories of failure, things that went wrong, times people mistreated you. It also tends to broadcast a lot of doom and gloom about the future. Catastrophizing, predicting the worst, worrying about bad things that will happen or what will go wrong. And it also tends to find a lot of problems in the present. Wherever it looks, it finds problems. And that is a normal, natural human mind. Now, you can do positive thinking courses and learn to think more positively, there's no doubt, but that's not going to stop radio doom and gloom from broadcasting. That's not magically going to get rid of all your negative thoughts. Just like if you learn to speak Spanish, you're not going to forget English. So what are we supposed to do? Have you ever done some sort of really engaging activity like reading one of your favorite books, and there was a radio playing in the background, and you were so engaged, absorbed in what you were doing, you hardly even noticed the radio was there. It was just playing away. And then maybe one of your favorite songs came on the radio, and suddenly you were really aware of the radio, maybe even singing along with it. And then the song changed and the radio kind of faded into the background again. What if you could learn to do that with your own mind? There are times when your mind is broadcasting really useful, helpful stuff about values and goals and strategies to make your life richer and fuller and more meaningful. What about at those times you could kind of tune into the radio and make good use of that kind of useful stuff that your mind is telling you? And the rest of the time when it's doing its radio doom and gloom stuff, just kind of let it play on in the background. This is very different to trying to ignore a radio, trying to not hear it. Have you ever tried to not hear or ignore a radio, or a loud voice in a restaurant, or a lawnmower outside your house? Isn't it the case the more you tried to ignore or not hear it, actually the more it bothered and disturbed you? It's also very different to bringing in a second radio trying to drown out the first one. Let's bring in radio logical and rational, or radio positive and optimistic, to try to drown out radio doom and gloom. It is very hard to focus your attention on an activity, to engage in doing something that matters, while you've got two radios playing two different channels in the background. One simple way that you can do this is just to notice when the radio is broadcasting its doom and gloom stuff and just simply name it. Ah, here's radio doom and gloom broadcasting in my head, or oh, there's my mind worrying or predicting the worst, or there's the I can't do it story, or there's the I'm not good enough story. Whatever it is that radio's doing, just non-judgmentally notice it and name it. So we don't get into a battle with these thoughts, we don't try to run away from these thoughts, we don't get swept away or bogged down with these thoughts. We just let them come and go like a radio playing in the background, and instead we focus our attention and our energy on living by our values, doing things that help us to create a rich, full and meaningful life.
Right, so that's acceptance and commitment therapy, and this is a third wave CBT therapy that's built on CBT. But as you can see, the aim is not to challenge your thinking. So acceptance and commitment gives you the tools to distance, to put a bit of space between you, who is in the present moment, and the bullying mind that gives you all the warnings that perhaps it shouldn't be giving you because you're at home and you can't do anything about work, for example. So ACT is this new kid on the block that is really, really successful, and it teaches you skills of separating yourself from the threat because the threat is not actually there. The World Health Organization has adopted it as the tool now to combat stress. And if you Google the title of this publication in front of you, the Doing What Matters in Times of Stress, you'll be able to actually get a really nice guide of step-by-step tools that will help you split from that bit that gives you the hard time. And ultimately, acceptance and commitment is about making a choice. And the premise here is that at any one moment in time, you have a choice whether you want to get hooked by your mind and your thoughts or remain unhooked. And the theory suggests that when we get hooked by our mind doing its thing, we tend to make away moves. Away moves are moves that take us away from the sort of person we want to be. Whilst if we manage to unhook ourselves from that, then we're likely to be more able to make moves towards the sort of person we want to be, towards the sort of life we're going to be living. So this is just a very, very, very quick tour of what acceptance and commitment does. And I would highly recommend it as a go-to tool to deal with stress. Now, there's one more video that I'm not going to show you because it's 9 minutes long, but we will add it into the chat. So you will be able to access it, because I really want to take your questions rather than show you more videos. That has been developed on the basis of acceptance and commitment therapy, and specifically talks about stress during COVID. So that will be, as I said, it'll be available in the chat, and then you'll be able to get it from there. So in summary then, stress, fatigue, burnout are not inescapable. There are things that you can do about it. You should be looking to restructure the environment if that is within your control. But if there isn't, you can actually train your mind to be able to give you a little bit of space between the stressors it warns you about, which are not currently present, and you being here in the present moment. I will end here. We will not watch this video, and we will move on to the last slide. Thank you very much. I shall stop sharing, shall I?
That was fantastic, Koula. Thank you. That was excellent. I am going to open up the images. Yeah, perfect. Thank you very much. That was fascinating and relaxing, which we all need on a Thursday evening. So no, I do really we do appreciate that. That was excellent. And you know, something that struck a chord with me was how you advise us not to switch our brains off, and you know, to let those thoughts be present, but to make them pass by as if they're cars just fleeting by, which was very interesting. And I mean, all of us have tried to forget our thoughts in the middle of some kind of meditation time, and it's impossible. You can't do it. And that's
you can't. So for example, if I said to you, do not think of a white bear now, what's the first image that comes to mind?
polar bear.
We cannot unthink our thoughts.
Exactly.
So acceptance and commitment is very much based on this idea. You can't switch this off. So you may as well just learn how to put a little bit of distance between you and your overzealous mind.
Yeah, no, and if any of the audience have any questions, or if someone would like to raise their hand and maybe share an experience they've had in relation to and you know how they manage the stressful situation, you know, in the context of COVID and special care, a lot of us, I'm sure, have found ourselves dealing with our patients and an influx of patients all at once, but as well as that, having to fight for them at the same time, because it was hard enough to establish services for our special care patients to begin with, but after the lockdown and then them opening back up, it's like we're having to have to do this all over again. So it's a lot of stress to kind of you know, burden ourselves with, and sometimes, you know, you can reach that next level of fatigue or, you know, even burnout. And I think myself, I definitely after kind of realizing the difference between the two, I've been burnt out and I didn't even know it, you know, and that's what was interesting is to identify those markers that signify burnout and to manage them that way. So yeah, no, that's excellent. Someone, Alice is just asking for the link to the video. Would you mind just opening up your screen share so that we can have a look at the video, if that's okay?
Yeah, of course.
Just so that we can see the title of it, and then I will link it. Yeah.
So it's, if you Google face COVID, and you might have to add Russ Harris, who he's the ACT go-to person, and I love him. There we are. I've just said it. It's recorded forever. I love him. Brilliant. So he's a medic by training, but he's kind of championed acceptance and commitment therapy. If you Google that, you should be able to find it on YouTube and play it. It's very COVID specific, but the techniques he talks about apply to any situation.
Fantastic. I wonder if anyone has any questions. If we have no questions and it was a very thorough presentation, then we might actually watch that video, because it is 5 minutes and that will round us up to 9 o'clock.
If you'd rather, yeah, we could do that.
That would be a good idea. Yeah.
Okay.
Perfect.
Sure. There we go. It's 5 minutes.
When we face a crisis of any sort, fear and anxiety are inevitable. They are normal, natural responses to any challenging situation infused with danger and uncertainty. Face COVID is a set of practical steps for dealing with such situations. F is for focus on what's in your control. You can't control what happens in the future. You can't control coronavirus itself or the world economy or what other people do, and you can't magically control your thoughts and feelings. Fear, anxiety, and worry are inevitable. But you can control what you do here and now. So let's focus on that. A is for acknowledge your thoughts and feelings. Silently and kindly acknowledge whatever is showing up inside you. Thoughts, feelings, emotions, memories, sensations, urges. With curiosity, notice what's going on in your inner world. You might say to yourself, I am noticing feelings of anxiety, or I'm having thoughts about getting sick, or I'm having feelings of loneliness. And as you continue acknowledging your thoughts and feelings, bring in the next step, which is C, come back into your body. Find your own way of connecting with your physical body. For example, you might try slowly pressing your feet hard into the floor, or slowly pressing your fingertips together, slowly stretching your arms or your neck, or shrugging your shoulders, or slowly breathing. And as you acknowledge your thoughts and feelings and come back into your body, you then move to E, which is for engage in what you're doing. Get a sense of where you are here and now and refocus your attention on the activity at hand. Notice 5 things you can see, 5 things you can hear. Notice what you can touch and taste and smell. Notice what you are doing and give your full attention to that activity. And then C is for committed action. This means effective action guided by your core values. Action you take because it's important to you, even if it brings up difficult thoughts and feelings. Of course, this includes following official guidelines on what to do during this crisis. But in addition, ask yourself regularly, what can I do right now, no matter how small it may be, that improves life for myself or others I live with or people in my community? And whatever the answer is, do it and engage in it fully. O is for opening up. This means making room for difficult feelings and being kind to yourself. As this crisis unfolds, we'll all feel fear, anxiety, anger, sadness, guilt, loneliness, and so on. We can't stop these painful feelings from arising, but we can open up and make room for them. Acknowledge they are normal, allow them to be there even though they hurt, and treat ourselves kindly. Consider what are kind words you can say to yourself and kind things you can do for yourself to help you cope with this suffering. V is for values. Committed action should be guided by your core values. What do you want to stand for in the face of this crisis? What sort of person do you want to be as you go through this? How do you want to treat yourself and others? Your values might include love, respect, humor, patience, courage, honesty, caring, openness, kindness, compassion, or numerous others. Look for ways to sprinkle your values into your day and let them guide and motivate your actions. I is for identify resources. Identify resources for help, assistance, support, and advice. This includes friends, family, neighbors, health professionals, and emergency services. Make sure you know the emergency helpline phone numbers, including those for psychological help if required. D is for disinfect and distance. Remember to disinfect regularly and practice physical distancing for the greater good of your community. Please run through the steps of Face COVID as often as you can for the benefit of yourself, your loved ones, and all the people in your community.
There you are. I'm so glad we actually managed to see this, because hopefully you see the actual practical tips that you can do, and really engaging with a psychologist who does acceptance and commitment just helps you develop strategies to put those tools into everyday life.
Yeah, no, that was well worth it. Thank you. Actually, I'm glad. And I always like mnemonics. They make me happy.
Good.
Margaret asked a very interesting question, actually. You mentioned previously, what to do and tips and tricks, and seeking support was one of them. But what if you're the person who wants to support someone else? How would you approach someone who you think might be becoming fatigued or burnt out?
That's a really good question. I was talking to Kev this morning about how support offered can be unsupportive unless it's been requested. And we had this long conversation of how support is actually unhelpful unless you have some clear indication from the person that they want support, and then you're offering the support that they would find supportive. So it's a very good question. It's always tricky to know how best to approach it, because this is a classic where one size doesn't fit all. But it's about being open about what you're seeing and acknowledging it non-judgmentally. For example, if someone is always the life and soul of the party at work, and for the past week they've been coming in, they're really kind of not themselves, you can just test the water out by saying, you don't seem okay, you seem different this week. Is there anything I can do to help? And then that's seeking permission to actually go into this person's world. They might say, no, go away, I'm quite happy. I don't want your support, thank you. And that in itself is then supportive, because where they don't want help, and you're not pushing to offer your help, because essentially, if they don't want help and you're pushing to offer help, you're not doing that for them, you're doing it for you. So it's very important that the support is actually pitched at the right person at the right level in a way that they would find support.
That makes sense, actually. Yeah, absolutely. And in the same, you'd approach it in the same way that you'd want to be approached, and some people are more vocal about it, and some people are more private about it, and it's at the right tone. So yeah, great answer. Perfect. Well, if that's everyone, then I think that's it. So I just want to thank you very much, Koula. That was another one of your fascinating and enlightening talks. So we do really appreciate it. It's very, very useful, and hopefully it'll be useful to more people. We will, this is recorded, and so it'll be available on our website. And feel free to share it to anyone who might, it might be relevant to anyone who you think might find it useful. And just one last thing, then we have even announced our summer conference for for June time, in the 11th of June, I believe, Friday the 11th of June. And it'll be presented by Caroline Joyce, wonderful dental hygienist, and Dr. Patricia O'Connell, a consultant in internal medicine, and Dr. Vicky Jones as well, and consultant in special care dentistry. So, and it'll be opened by someone near and dear to the ISDH, Dr. Alison Dougal, and we hopefully look forward to all of you being there. So the registration will become available hopefully later next week, and check up on our social media and our website to find the latest details later on next week. So thank you everyone for attending. I hope you learned a thing or two. You probably did. And we will see you in our next get together.
Thank you very much for inviting me. Really enjoyed talking to you.
Thank you. Best of luck, everyone. Goodbye.